You're pregnant and you're wondering, how many tests do I need to do? How many times are they going to check my blood pressure? I'm Zainab, I'm the pharmacist from PillSorted, and I'll explain all of the antenatal appointments and tests that we do, and why do we do them, and why are they so important. The whole of these screenings and appointments are about prevention, are about planning and doing the best support for yourself and the baby. The first appointment that you usually have is around week 8 to week 12, and this will be one of the most in-depth and detailed appointments that you'd have, because it's an important one that helps us create a picture around you to understand what are the risk factors and what supports you're going to need. We're going to be asking a lot of questions. For example, your weight and height will be checked, then your medical history, all your current medications, and your lifestyle. Again, if your BMI is higher than the healthy BMI, it's more about being able to put the right support around you. For example, you might need some additional glucose testing, you might need some additional scans, and we need to make sure that we plan them in place. What are the important things that we check? There's 4 important things that we check all the time. One is your blood pressure. Pregnancy drastically changes all of your blood circulation. As I said, your body will be increasing the blood volume you have, your heart will be beating much faster, and all of this to make sure that your baby receives enough oxygen, enough blood to be able to sustain the growth. The other important thing is, if your blood pressure goes up during pregnancy, it might be one of the symptoms of preeclampsia. I'm going to explain that in a separate video, but that is one of the risk factors for the mother, so that will be something we check. Now, the other important test is urine tests. So in the urine test, we're looking for 2 things. One is infections and the other one is protein. So if there's infections, we can put preventative measures in place for it, and if there is protein, we'll monitor more regularly, because if there's high protein in the urine combined with high blood pressure, those can be signs of preeclampsia, which we'll be monitoring more carefully. The third test is blood tests. So these will be full-on blood tests, both to see your blood group, your rhesus status, your iron levels. The things that we want to make sure that we help and support early on is anemia. So if there's low iron in your body, that would mean there'll be less blood cells available. So we want to make sure that you've got enough iron. Scans are the 4th one. So there is a dating scan that's around week 12. It tells us roughly when you're going to be due. The more detailed scan is the week 24, which is where we look for different anomalies, or we look into all the parts of the baby's growth. So that's a very sweet one, because you'll see the baby just moving around on the screen, and you'll be shown the different parts of the baby, from their heads, from their toes, from their heart beating. Is really a sweet moment. The final scan will be probably towards the 3rd trimester, just to make sure that everything is developing properly and there's no issues. About your weight checks, we will be regularly checking your weight. Is a really good thing for yourself to check your weight as well. Not every day, but at least on a weekly basis, so you know where the trend is going. I have explained in previous videos about the 3 trimesters of pregnancy and how your weight will be changing according to those trimesters and the physiological changes that are happening in your body. The doctors will be looking for, is there a trend of you losing weight or putting on weight too fast? So all of these will be things that they'll be monitoring and talking to you about. Other important screening is the mental health question. So it's really important to understand how a mother is feeling about their pregnancy. Are they too anxious about it? Are they worried about their weight changes? Do they have enough support in their family or a support system around them to support them with the pregnancy and birth? Because if you're struggling with any of these, if you're worrying about how your body is changing so much, if you're worrying about after giving birth, this is a good time to reach out and talk about it so that support can be put in place. Another important one, we have checked about medication during pregnancy, but I want to talk about vaccinations during pregnancy as well. So some vaccines are given during pregnancy, not just because we want to protect the mother, but we want to transfer that protection to the baby as well. So one of the important ones is the whooping cough. So whooping cough is very dangerous for babies, and babies will get the whooping cough vaccine after week 8. But if the mother, a pregnant mother, gets the whooping cough vaccine, she can transfer that protection to the baby. So it's quite beneficial. There are a number of other vaccines that are really helpful as well. So for example, the flu vaccine, COVID vaccine, both of these are safe for the mother and could be beneficial for the baby. So definitely talk about these to the doctor as well. As a recap, routine checks, routine screen tests, vaccinations, all of these are to be able to keep mother and baby safe, help them manage the pregnancy and support them for long term. This video is part of our pregnancy series videos. Visit our website and reach out to us for that clinician-led safe advice. Thank you.